now with Dr. Ania Jastreboff, an endocrinologist and associate professor at the Yale School of Medicine.
As we said, she teamed up with Oprah on the new book, Enough, Your Health, Your Weight, and What It's Like to Be Free. And she's going to debunk some common myths about these weight loss medications. Let's start with the first one.
Okay.
So the first myth is that everyone who takes obesity medication experiences side effects.
So as we just talked about, there are no medicines out there that don't have side effects for any disease, and obesity medications are no different. There are common side effects, and we talked about these.
Right.
Nausea, vomiting, diarrhea. Vomiting is very rare as long as you go up on the medicines slowly.
And I think the larger question a lot of people are wondering, is this tested? Are there long-term effects that we look up 2-3 years from now and then something is wrong?
So the class of GLP-1 based medications have been around for 20 years for treating people with diabetes. Most people with type 2 diabetes have obesity, so we do have that amount of data. Having said that, we have to continue doing the studies, and for every patient, it's risk versus benefit. What are the benefits that can be gained in terms of health?
And there's tons of health benefits,
yes,
right?
Tons of health benefits.
So myth number 2, everyone who takes obesity medication microdosing is known to be safe for people who do not have obesity. This is the big question, because a lot of people are microdosing.
Because there are also people that maybe aren't obese, but
just
would like to lose, 10, 15
So
pounds.
microdosing, micro just means small or mini doses. Now, sometimes we use small or mini doses for people who have obesity or who are overweight with obesity-related diseases. We do not have data in people who do not have obesity or these obesity-related diseases. So we don't know what the risk-to-benefit ratio is. And that's why we use them for people with obesity or these obesity-related diseases, not for people who do not have obesity.
Okay. All right. So let's move to our myth number 3. So you're saying you don't necessarily recommend somebody that is
people are
just
like,
wants to lose weight.
my high school reunion's coming up.
Or going through menopause.
Yeah.
That's correct. And I do see a lot of people who go through a lot of women who go through menopause. But again, those studies need to be done.
Okay.
We need to do those studies.
Let's talk about this one. Obesity medications makes you completely lose interest in food.
So I get this question so much.
Yeah.
I'm going to start these medicines and I'm just not going to want to eat the food that I like to eat. During the first phase, when people are just starting to lose weight, in that initial phase, the appetite does go down. Over time, that will come back, and that's normal. So the weight won't come back, but your appetite will, and that's perfectly normal because, again, what the medicines are doing are resetting that enough point. That enough point. So once you get to that new enough point, then your appetite comes back, but the weight doesn't.
Okay, I love that.
Okay.
Thank you so much for coming in.
Well, Dr. Ania is going to stick around because we're going to talk more about weight loss medications and busting a couple more myths right after this. We are back with Dr. Ania Jastreboff, an endocrinologist and associate professor at the Yale School of Medicine, and we are talking about weight loss medications known as GLP-1s. Let's get to myth 4, which is weight loss continues indefinitely while you take obesity medications.
So I see this so commonly. Patients say, I'm taking the medicine, it was working, and now I stopped losing weight. It's not working anymore. And actually, the medicines work in a way where initially they decrease your weight because they are resetting your enough point to a lower place. Once your enough point is reset, then you plateau. Then your weight evens out. The medicine is still working. And just as Oprah just said in the last segment.
So meaning you've reached where you should reach.
Yes, and here's the thing. Let's say you lost weight indefinitely. We would disintegrate and die.
Yeah.
Just like
so you need to say, that makes sense.
If you had a high blood pressure medicine and it lowered your blood pressure indefinitely, it would be too low. So we actually don't want that.
We have like 30 seconds to squeeze in myth number 5. These medications cure obesity.
Yeah, so as with many medications for chronic diseases, these medications do not cure obesity, which is why in order to continue treating obesity, you have to continue taking them, right? So you can maintain that new enough point so that your weight stays stable and so that you can have all the health benefits, the heart benefits, the obstructive sleep apnea benefits, the blood sugar benefits, all those benefits for them to be maintained, you have to keep taking the medicine.
Oh, well, thank you, Dr. Ania. And check out the book, Enough, which she co-wrote with the Queen, Oprah. You can get it at your indie bookstore or head today.com/books.
All right, we'll be right back after this.